Gentlemen, if you are over 60 years old and your intimate health truly matters to you, take a few minutes to listen to what I'm about to tell you. This message is for you and could truly change the course of the coming years of your life. I am Dr. Mélanie Rousell, a doctor for over 20 years, and I have supported a great many men who came to consultations far too late, often after months, sometimes years, of ignoring the signals their bodies were sending them. What I'm going to share with you today is not just a simple comfort tip, it's a serious alert. Your health, your quality of life, and sometimes even your survival are directly linked to what we're going to discuss together. Many men avoid this topic out of embarrassment, modesty, fear of ridicule, or because they think that at their age it's normal. But this silence comes at a high cost, a very high cost, and regrets often come when it's too late. In this video, I'm going to reveal the 10 most dangerous mistakes that men over 60 make with their penis, and that you absolutely must avoid. I'm willing to bet that you're making at least one, maybe several, without even realizing it. And believe me, mistake number 10 is the one I consider the most serious and the least known. Stay until the end because these few minutes can truly preserve your intimate health for the years to come. Before we start, ask yourself a question. Among these 10 mistakes, which one will surprise you the most? Shock you or make you reflect on your habits? Keep that in mind as you listen. At the end of the video, tell me in the comments by simply mentioning the number of the mistake that struck you. This is a judgment-free space dedicated solely to your health. Mistake number 1, ignoring the signals from your penis. Many men notice small changes and tell themselves it's normal, it's age, it'll pass. Yet your body speaks constantly, and your penis is an excellent indicator of your overall health. Ignoring it is like turning off the warning light on a car's dashboard without fixing what's wrong. Changes in color, redness, slight discomfort, itching, mild pain, decreased sensitivity, difficulty urinating. All of this is a language, and that language must never be ignored. I remember a patient I'll call Mr. D, a man a little over 60 who had noticed a small lesion on his penis. It didn't really bother him, sometimes a bit, but he told himself it was nothing. He waited more than a year before consulting. When he came to see me, the exam and tests revealed a much more serious illness than he imagined. If he had come a few months earlier, the treatment would have been much lighter, much less painful, with far fewer consequences on his daily life. I completely understand that the idea of showing your penis to a doctor can be embarrassing. It's human, but that embarrassment lasts a few minutes. The consequences of inaction can last your entire life. Immediate action. Today, take 2 minutes alone in a quiet place. Look at your penis in a mirror. Observe the skin color, any possible spots, small bumps, lesions, painful areas. Touch it, palpate gently. The more you know your body, the more you'll spot anything that changes. Mistake number 2, playing the amateur sorcerer with home remedies. The internet, forums, private groups, non-medical videos are full of supposed miracle remedies for the penis. Natural creams, ancient recipes, magic oils, exercises guaranteed to enlarge or strengthen. You've surely seen these kinds of promises, but behind them there are very real risks. I've seen men in consultations who had applied creams bought online or homemade mixtures to their penis, thinking to fix a small inflammation or improve their performance. Result: burns, severe allergies, infections, scars, and in some cases, hospitalization. A man I followed, whom we'll call Mr. L, had used a natural ointment found on the internet to soothe an irritation. Within a few hours, the area became red, hot, very painful. Severe allergic reaction, hospitalization, treatment, fear, shame. What could have been fixed with a simple consultation degenerated into a real nightmare. Modern medicine today has serious, tested, safe solutions for most male intimate problems. Why risk your penis with uncontrolled products, often anonymous, sometimes made without any safety standards? If you have a doubt, discomfort, pain, talk to a healthcare professional. That's the only reliable and responsible way to truly protect yourself. Mistake number 3, neglecting the hygiene of your penis. This may seem basic, but after 60, many men let their guard down on intimate hygiene. Result inflammation, bad odor, infection, and sometimes more serious complications. If you're not circumcised, you absolutely must make sure to retract the foreskin under the shower to properly clean the glands and the folds. When this isn't done, secretions, sweat, and cellular debris accumulate. It's an ideal breeding ground for bacteria and fungi. I've followed men suffering from chronic balanitis, that is, repeated and persistent inflammations of the glands. The pain, redness, itching, discomfort, urinating, all of this could have been avoided with proper hygiene. Conversely, using aggressive soaps, highly scented ones, or irritating products is just as problematic. The skin of the penis is thin, fragile, sensitive. Too aggressive washing can cause irritation, microfissures, burning sensations. Immediate action. Choose a mild soap with neutral pH, without fragrance. Wash the intimate area thoroughly once a day, taking the time to rinse well and then dry gently. Simple, regular, non-aggressive hygiene is one of the most effective gestures to prevent many problems, including some rare types of cancer. Mistake number 4. Turning a blind eye to pain, injuries, or bleeding. Many men notice a small wound, an ulcer, a scab, a red spot, a streak of blood in the urine, and decide to do nothing. They hope it'll disappear on its own. But sometimes this small problem is the first sign of a silent and much more serious illness. The presence of blood in the urine is always an alarm signal. It can range from a simple urinary stone to serious diseases like bladder cancer or urinary tract cancer. A wound that doesn't heal, that persists or worsens, must also be taken very seriously. I think of a patient I saw, Mr. R, over 60, who had a small wound on his penis for several months. Out of embarrassment fear, he postponed the consultation. When he finally decided to come, the exams revealed an already advanced tumor. The delay in care had a significant impact on his quality of life. You must keep this in mind. A healthcare professional is not there to judge you, but to help you, examine you, treat you, and sometimes save your life. Shame lasts a few moments. The consequences of a delayed diagnosis can last years. Mistake number 5. Without protection. After 60, some men think they no longer need condoms. They tell themselves there's no more risk of pregnancy, that sexually transmitted infection are for the young, and that they can afford to neglect protection. This is a serious mistake. Sexually transmitted diseases have no age limit. Syphilis, gonorrhea, HIV, HPV, chlamydia, all these infections also affect older men. And in them, the diagnosis is often later, symptoms sometimes less obvious, and complications heavier. In my office, I have seen men who thought they were living a new youth after a separation or widowhood, and who trusted partners without using condoms. A few months later, the diagnosis came. Sexually transmitted infection, treatment, exams, worry, sometimes impact on several partners. There's also another lesser-known risk, penis fracture. It occurs during very intense sexual intercourse when the erect penis undergoes a sudden bend. The pain is immediate, the erection disappears, a hematoma appears. It's a surgical emergency. Without quick care, the sequelae can be significant with persistent erection problems. Protect yourself. The condom is not just a means of preventing diseases. It's also a tool for peace of mind. And peace of mind at this age is precious. We're about a quarter of the way through this video. If what I'm explaining seems useful to you, if you think this information can help you age better, stay active and healthy, subscribe to the channel and turn on the bell. That will allow you to not miss any of my upcoming videos on men's health, and it helps me continue to offer you serious and accessible medical content. Mistake number 6: exposing your testicles to excessive heat. The testicles are located outside the body for a very specific reason. They need to be at a temperature slightly lower than the rest of the body to function properly. When they're subjected to too much heat for too long, it disrupts their functioning. Prolonged sauna sessions, very hot baths, frequent jacuzzis, hot water bottles placed directly on the groin, laptop on the lap, very tight clothing, all of this increases the local temperature. In the long term, these habits can reduce sperm quality and disrupt hormonal production, which can translate into lower energy, fatigue, lower libido, an impression of general decline. I've met men who complained of being exhausted, lacking drive, with an intimate life losing speed. By questioning them, we identified repeated habits of genital heat exposure. Once these habits were changed, combined with medical follow-up, their overall condition improved. Even keeping your cell phone constantly in the front pants pocket combines heat and waves. The scientific evidence is still ongoing, but as a precaution, I recommend limiting this exposure. The solution is simple. Prioritize non-compressive underwear, loose clothing. Avoid placing the laptop directly on your thighs. Limit prolonged, very hot baths. These are small gestures, but their long-term impact on your vitality is not negligible. Mistake number 7: being too aggressive with your penis, especially during masturbation. Many men think that masturbating very vigorously has no consequences, that it's a personal practice that concerns only them on a moral level. That's true, it only concerns you. But on a medical level, certain behaviors can have effects you don't suspect. What is sometimes called the death grip refers to a way of masturbating with very strong pressure, a very intense rhythm, often always in the same way until the body only responds to that type of stimulation. The problem is that no real partner, no normal sexual relationship can reproduce exactly those conditions. Result: difficulty feeling pleasure during intercourse, very long delays before orgasm, or conversely impossibility to achieve it, progressive loss of sensitivity, frustration, misunderstanding, loss of confidence. I've met patients convinced that the problem came from their partner or that they were broken, when the core of the problem was conditioning created over the years. By changing their masturbation habits, going more gently, using lubricant, varying stimulations, they gradually regained more natural sensations. Beyond the psychosexual aspect, too abrupt, too violent movements can cause internal microtraumas. Small internal tears that, healing poorly, reduce tissue elasticity. In the long term, this can contribute to curvatures, pain during erection, or decreased rigidity. Your penis is not a tool, it's a fragile organ irrigated by many small blood vessels. It deserves gentleness, respect, and moderation. Mistake number 8: smoking, drinking excessively, and remaining sedentary. Tobacco, alcohol, lack of physical activity. Here's a devastating trio for overall health, and intimate health is no exception. Tobacco damages arteries, reduces vessel caliber, prevents blood from circulating properly. The penis is one of the first organs to suffer from poor circulation because erection depends directly on quality blood flow. Many men who consult for erection problems actually have arteries weakened by years of smoking. Excess alcohol overloads the liver, disrupts hormonal metabolism, reduces available testosterone, alters sleep, increases fatigue. In small occasional doses, it may seem harmless. In regular or excessive doses, it becomes a direct enemy of your sexual vitality. Sedentary lifestyle finally contributes to weight gain, increased abdominal fat, chronic inflammation, diabetes, hypertension. All these factors deteriorate circulation and nerves, two fundamental elements for a satisfying, intimate life. Changing this doesn't mean becoming an athlete. It means walking every day, taking stairs instead of always the elevator, practicing a gentle but regular activity, limiting cigarettes, reducing alcohol, sleeping better, breathing better. By improving your overall health, you'll almost automatically improve the health of your penis. Mistake number 9. Being too hard on yourself. Letting stress and self-criticism destroy your intimate life. The mind plays an immense role in sexual health. After 60, it's very common to go through periods of doubt. Physical changes, illness, bereavement, separation, retirement, all of this can weaken the image you have of yourself. Many men judge themselves harshly, compare themselves to what they were at 20 or 30, and tell themselves they're no longer men because their erection is less strong, less frequent, or because they need more time. This inner dialogue is extremely destructive. I followed a patient, Mr. G, about 70 years old, who put enormous pressure on himself during every intimate encounter. He was afraid of failing, afraid of not measuring up. This anticipated stress triggered exactly the difficulties he dreaded. The vicious cycle was in place. By working on his stress, reestablishing calmer communication with his partner, accepting that the body changes with time, he regained a much more fulfilling, intimate life, with less anxiety and more pleasure. Your value is not summed up by the performance of your penis. You have the right to have good days and bad days. You have the right to be tired, preoccupied, less available. The essential thing is not to condemn yourself and to seek help when you feel the mental aspect is taking over. Mistake number 10, the most serious in my opinion. Completely abandoning the use of your penis. Many men from a certain age tell themselves that intimate life is over, that they're too old, that it's no longer for them, that it's no longer important. So they cease all sexual activity, whether with a partner or solo. They no longer stimulate themselves, observe themselves, or touch themselves. The problem is that the penis is an organ that needs activity to stay healthy. Even nocturnal erections that you don't control serve to oxygenate tissues, preserve fiber elasticity, maintain the suppleness of internal structures. When erections become rarer and on top of that you voluntarily abandon all stimulation, tissues can gradually lose their suppleness. Phenomena of atrophy and fibrosis can appear. The penis may seem shorter, less firm, harder to erect. I've seen men who, after years without any intimate activity, returned to sexuality, sometimes after a new encounter, and discovered with surprise that their penis had changed. They thought it was just age. In reality, the total and prolonged abandonment had accelerated this transformation. Intimacy is not limited to penetration. It includes touch, tenderness, caresses, respectful masturbation, closeness with others, and with your own body. By maintaining a certain activity at your own pace, without performance goals, you send your body the message that this function is still important. Of course, the frequency won't be the same as at 20, and that's okay. What matters is not to give up completely out of fatalism or shame. Take care of your penis as a barometer of your overall health by looking at it, touching it, listening to it. You take care of your whole body. We've reviewed the 10 major mistakes I see too often in men over 60. Ignoring signals, using dangerous remedies, neglecting hygiene, turning a blind eye to pain, having unprotected relations, exposing testicles to heat, being too aggressive with masturbation, smoking, drinking, and staying inactive, judging yourself constantly, and finally, completely renouncing the use of your penis. Each one taken alone may seem trivial, but combined, these habits slowly, silently damage your intimate health. Today, you have the opportunity to change that. Ask yourself which of these mistakes concerns you the most? Which one surprised you the most? Tell me in the comments. That will also help you become aware of your priorities. If you want to go further, if you need personalized advice tailored to your situation, contact your primary care doctor or a specialist in urology or sexology. Don't stay alone with your questions. And if this video was useful to you, don't forget to subscribe, turn on the bell, and share it with a friend, brother, or loved one who could benefit from it. You could really help them avoid serious problems. I am Dr. Mélanie Rousell. Thank you for your trust and see you very soon for a new video dedicated to your men's health. Take care of yourself. Your intimate health deserves all your attention.